Welcome to endometriosis. Today we'll take you through the essentials in just a few minutes. Endometriosis is a condition that affects millions of women worldwide, yet it's often misunderstood. Let's break it down step by step. In a normal menstruation cycle, the lining of the uterus, also known as the endometrium, thickens, breaks down and sheds during menstruation. While in endometriosis, tissue similar to the endometrium grows outside in the uterus, often on the ovaries, fallopian tubes, or pelvic lining. This tissue responds to hormones just like the uterine lining. It thickens and bleeds, but with no way to exit the body. It causes inflammation, pain, and scarring. The exact cause of endometriosis is still unknown, but theories such as retrograde menstruation suggest that menstruation blood flows backward into the pelvic cavity, while immune system dysfunction causes inability to clear misplaced tissue. On the other hand, genetic predisposition increases the risk as a family history factor. Endometriosis affects an estimated 190 million women globally, which is about 10% of the reproductive age women, whose symptoms include severe menstrual pain, heavy bleeding, chronic pelvic pain even outside periods, pain during sex, bowel movements or urination. Gastrointestinal issues and infertility are also symptoms to watch for. Beyond physical pain, endometriosis can affect mental health, leading to depression and anxiety. It also affects relationships and workplace productivity. This burdens the economy significantly, with the cost averaging $16,000 annually for every woman. On average, women wait 7 to 10 years for proper diagnosis. This is due to misdiagnosis, whereby up to 10% are misdiagnosed with IBS, and black women are 50% less likely to receive timely diagnosis compared to the other groups. Briefly, let's talk about diagnosis, which is often delayed due to symptom overlap with other conditions. Doctors may use imaging, but laparoscopy, which is a minimally invasive surgery, is often needed to confirm endometriosis. By the way, there is no cure, but treatments help manage symptoms. Options include pain relief using NSAIDs, hormonal therapy such as birth control pills, and gonadotropin-releasing hormone agonists, or surgery to remove endometriotic tissue or adhesions. While lifestyle support, such as exercise, diet adjustment, and mental health care, can help manage the burden. Endometriosis is more than just painful periods. It is a chronic condition that deserves understanding and care. Therefore, together we can break the silence and support those affected. Thanks for watching. My name is Skylar.